Welcome back to the Live Free Miami podcast. I'm your host, John Kelly, and I'm here with member of the gym, nurse at the VA, and gut specialist, Afreen Kisten. That's right. If you ever need to remember her name, you just think of Kisten. And we're here to talk about gut health, probably one of the most overlooked aspects of weight loss, cognitive function, and general quality of life. We're also here with our sponsor, TrueLeave, who gave me this really cool cup, and NoCo, who dropped off a bunch of NoCos for me to try. Thank you very much, you guys. TrueLeave is the number one company if you need any CBD or THC. And NoCo makes a great sugarless post-workout amino acid drink.
Drinko.
That being said, Afreen, welcome back. I'm so glad you came back for the second time because the first time we had some technical difficulties. So I just want to get right into it. Why don't you tell the audience a little bit about yourself real quick, and then we'll get into how important gut health is.
Thank you for having me again, John. This is such a pleasure always, and fun times always.
Very fun.
Again, well, I'm Afreen Kisten. In the medical world, I'm a functional nurse practitioner, and in the functional world, I'm a functional nutrition and wellness practitioner. And my main focus is overall health, but kind of really digging into your gut. Because as Hippocrates said, all disease begins in the gut.
He said that?
He sure did.
He also said, which I like to quote all the time, is make your medicine your food and your food your medicine.
Absolutely.
And this was before he even had a microscope.
That's
this guy
right.
was on top of it.
See that? Going back old school.
Yeah.
We're bringing it all back.
Yeah, it all comes back, right?
That's right. That's right. So, John, did you know that 80% of our immune system lied in the gut?
I did know that from our last conversation, but that doesn't mean that I'm taking that information and using it to my full advantage because, like many other people, I haven't been eating to optimize my gut. So just hearing you say how important it is for your immune system, especially in this day and age, is really an eye-opener. And everybody that I talk to in the gym that's having trouble with losing weight, I always ask them, have you checked your gut?
Right.
And none of them have checked their gut.
Right.
So I think it's really important that we get this message out to people that, hey, we all get our blood work done, we all get our blood pressure checked, but none of these doctors are checking our gut where everything begins.
Right. And really important to say because our gut, if you think about it, is our soil. Just like our last conversation, and it still goes. Nothing has changed. Our gut is our soil and where our roots begin. And if our gut is not healthy, we don't feed it the nutrients it needs to fertilize the rest of us, what's going to happen? We are going to start breaking down. Think of it as that beautiful tree. If the root is sick, the branches are going to be sick. The leaves are going to be sick. And what's going to happen to your fruit?
It's going to taste bad.
Exactly. There you go. It is going to taste bad. That's right.
It's going to
taste bad. It is going to taste bad.
You want your fruit tasting good,
That's
everybody.
right. That's right. So you're going to have to feed it with the good fertilizer, not the bad one.
Wow.
Yeah.
That's a great analogy. So why don't you explain to everybody how the gut works as the soil? Because it's a great analogy that the gut is where everything starts. But why don't you give us a little bit of like a physiological explanation of how that works?
Yeah, good question. So everything that we choose to eat ends up in our gut, no matter what it is. It's good, bad, the ugly. It ends up in our gut. Now,
is our gut our stomach? Or is our gut like our intestines?
Another good question. So a lot of people think our gut is our stomach, but our gut is really our intestines. Our stomach is our stomach. So our guts, as we talk about, is really our intestines. And all our food, all our nutrients are absorbed in our small intestines, to make it really technical. So whatever we choose to put into our body through our mouth will absorb in our small intestines and feed the branches, the rest of our organs, which our skin is our organ, our eyes, just everything. It feeds us, okay?
Yeah, well, your organs, it's we think of our organs as static,
Yeah.
but actually they're replenishing themselves all the time. So those nutrients that you're eating are becoming your organs.
Right.
And if your gut is not processing those nutrients, then you're going to have vision problems. You're going to have inflammation issues,
Skin problems.
skin issues,
Yes.
cognitive issues.
Mental is a very, very big one because we're constantly hearing, I'm anxious. I go to the doctor, I get some meds, I'm labeled anxiety. I give that diagnosis now. I have anxiety and I roll with it. I just get the medication
normal
and I
now.
go, yeah.
It's normalized.
Depression, all of that, but nobody looks at the gut. And another very, 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 very thing that, and it's new, is our microbiome. So our microbiome is pretty much made up of bacteria. We are about trillions and trillions and trillions about trillions made of bacteria. We've got good bacteria and we've got bad bacteria. They both belong there, okay? Now, we feed them. We feed the good bacteria, the good things, and the bad things are ugly or bad bacteria decides to, feed off of, and they replenish itself. And what happens is that they grow more and our good bacteria becomes less. So there's nothing to fight for us. Okay?
So when you're eating certain foods, they dictate on which bacterias grow
Yes.
and which bacterias don't?
Yes.
So which foods increase bad bacteria?
Sugar, gluten, dairy, GMOs, processed, just everything that's pretty bad. Everything that we've found a label for.
So bread is a double whammy.
Absolutely.
Because it has gluten and sugar.
Absolutely.
And any kind of sweet,
Yes.
right? That's a bad one. Now you said GMO, which means genetically modified organisms. And what people probably don't well, I don't want to say people, what all of us probably don't understand is that corn
Yes.
is the most genetically
Yes.
modified organism
Yes.
in our produce, and high fructose corn syrup
Right.
is in many, many different products.
Right.
So even if you're not eating corn, it's going to have high fructose corn syrup,
Yes.
which is GMO,
Yes.
which is going to screw up your gut
Yes.
on top of screwing up your insulin levels.
Yes.
So
Exactly.
when you're thinking about getting food, you want to think about getting whole foods, first of all.
Absolutely.
And then second of all, you want to make sure they're grown organic.
Right.
So that they don't have genetically modified
Yes.
issues, or they don't have synthetic fertilizers.
Right.
So all of those things affect our gut.
Absolutely.
So it really goes back to understanding what it is you're buying, where it comes from, and how it is absorbed in your body.
Yes. Very, very, very important because everything either absorbs or not. So if you are ill and, we do check our gut, one of the testing that I do are called, the GI mapping. Very important. We check everything. I'm talking about from mouth to anus. We check everything, all the bacteria we check. And if we pick something up called leaky gut, we know that the nutrients was not being absorbed. Why? Because now your small intestines have become so permeable, okay, that everything has gone through. It's become tight junctions. It's called tight junctions. And when the bad things are not being able to absorb, what happens? It starts to get very thin, starts to open. So all of our good, bad, and ugly gets through there. What happens that it goes to our bloodstream, right, for lack of a better words, and our immune system starts to activate. It starts creating antibodies against everything, good, bad, and the ugly at this point.
So like an autoimmune?
Right, so that's where you get your autoimmune disease from. Our immune system activates and says, hey, you don't belong here. You don't belong here. No, you attack. And that's what happens. So now if you feed the bacteria the right things, everything's able to absorb and give the nutrients to the rest of our body. So if you keep feeding it the bad things, our gut, our lining becomes very, very permeable. So everything just goes through. So now we've got double whammies for everything. We're starting to have joint pain. We're starting to have skin issues. forget about the bloating. That's sometimes the understatement. Everybody's like, yeah, that's my norm. No, it is not your norm. Something is going on.
Right.
You know, so you get all these symptoms.
What about kids and acne?
Oh, absolutely. Children are my number one focus these days because acne's one, the bloating. I'm picking up H. pylori in children. This is a bacteria that we've been picking up in a lot of the little ones. And it's very, very bad because it causes a lot of issues. Low stomach acid it causes. Our pancreas starts getting affected. Our gallbladder, our liver, just everything starts breaking down all at once. You know, so we really need to focus on what we put in our body, and not to mention what we put on our bodies, because our lotions are also filled with all these synthetic things and artificial stuff and gluten. I'm seeing a lot of skin products with gluten in it. So there's so much hidden stuff that we need to stay away from, and it's very hard to read and educate about everything because we're gonna think, you know, hey, the air is bad. What should I do? Just go on intermittent fasting? I'd say yeah. You know, but it's a lot, and our gut really is the gatekeeper for everything. You know, everything in our mind. I mean, the biggest one. If our gut's not working, our mind cannot work. Our brain, like we mentioned the last time, is our gut is our second brain, and our brain is our first brain. And if our second brain's not working, our first brain's not going to work either.
No.
You know?
Yeah,
so
they work hand in hand.
Yep.
And your gut has many neurons, just like your brain does.
Absolutely, yes. We are talking about the vagus nerve here. It's a big connection.
So a lot of people are experiencing, like you said, gallbladder issues, pancreatic issues. They're also experiencing anxiety, depression, skin issues. And then doctors are treating that with medications, which are also going to treat the symptom, but they're not going to get to the root of the problem like we talked about.
Right.
So why don't you think more people or more doctors are having their patients check their gut first before they do all the other things that they're doing with people?
It's, you know, it's difficult because I did learn everything medicine, and we weren't educated that way. We were educated on the way of what's this person's symptom, give them a diagnosis for that symptom, and treat them with pharmaceutical. There wasn't anything really about nutrition, and you know, we've had lifestyle. A couple of nutrition classes. No, not the lifestyle. It's a very big disconnect that, you know, with the doctors and just everything that we've learned in school. So it's really not their fault because we weren't educated in the functional way. And honestly, functional medicine is quite new, you know, by a couple of years or so.
I think it's coming back because I think functional medicine was very prevalent in the past. And then when pharmaceutical companies started making large contributions to universities, they began to dictate on what was being taught.
Right.
So imagine if you have a business that sells something and then you educate a whole generation of people to prescribe what you sell.
Yes.
And we wonder why we keep running into these health issues, and we see an increase in Alzheimer's, we see an increase in diabetes, we see an increase in depression, and more you're seeing people given pharmaceutical drugs, but less and less you're seeing functional doctors who are actually looking at the holistic picture. And it's just like fitness. Fitness and health is very comprehensive. You can't just come to the gym and expect to be healthy. You have to eat right. You have to sleep right. You have to practice stress management techniques. You have to know where your food's coming 100%. From. You have to educate yourself on what's in your food, what's in your water, and you are responsible for your health.
That's right.
Now, I think we need, especially post-coronavirus, we need to look at our health as being our number one priority.
Absolutely.
Because as you can see, when you do not have your health, you become a burden to yourself, a burden to society, a burden to your family. And then if you are somebody who has a comorbidity like diabetes or high blood pressure, now you're in danger of dying. Before it was you could take a pill and you can function in a normal way. But we're starting to see that we understand now that people who have comorbidities are much more likely to die from a virus.
Right.
So one of the things that I'm thankful for the coronavirus for is it's actually opening people's eyes
Yes.
to holistic health.
Yes.
I've been preaching this for years now, and people hear me, but they're not listening.
Right.
Because it's easy to just go about your day normally when you know there's a quick fix.
Right.
But when your life is on the line, now you got to rethink
Right.
your behavior patterns.
Exactly.
Now you got to rethink what you're putting in your body
Exactly.
and how you're spending your time. Because we always used to think that work and school should be our number one priorities, but when we're faced with the challenge that we were faced with last year, people lost their jobs, people were not allowed to go to school, and all of a sudden you're stuck with not being able to do the things that you thought were important.
Right.
So it's almost like we've been programmed from an early age to think that doctors are going to take care of us. The government is going to take care of us, when all of that is not true.
It's not.
We are the ones responsible for our
right.
health. And the
That's right.
first thing we need to do is assess ourselves
Right.
and see where we're at.
Right.
And that's where the test comes in. Can you tell us a little bit about the test that you do?
Okay, so I do a few of them, but I always start in the gut with the GI map. So the GI map, as mentioned, it pretty much looks at all your cells. It looks at all the digestive organs. So your large intestines, your small intestines, your stomach, your pancreas, your liver, and just everything else in between. It looks at all the bacteria, the good ones, the bad ones. We look at what's high, we look at what's low. We look at your stomach acid. We look at, viruses that's in there. We just look at all the parasites, and all parasites don't show up, but some do.
Where do the parasites come from?
Parasites do come from water that we drink, foods that we eat, whoever we kiss, traveling, just everything,
And
everything.
the different areas of the body that we kiss.
That's right. It's true. But the thing is, the good thing about our body, and just the most important part of our body, is to pass these things. Viruses are going to be around us.
always
Parasites are
have been.
going to be around us. Bad and good bacteria is going to be around us, and they're there for a reason. It is also part of the ecosystem, okay? But our bodies were made to excrete these things. So now if our body is sick, how are we going to do that? And this is what shows up. So for example, if our stomach acid is low, we cannot pass that parasite, okay? And a lot of people think that acid reflux or burning and all these different, upper GI issues are high stomach acid. That's incorrect. Our stomach is acidic. It has to be acidic. If it's not acidic, then we cannot kill the parasites. We cannot break down our foods. Okay, so when our stomach acid is low, everything hangs out there. There's nothing to kill it. So now our parasites stay, they invite friends, they have a big old party. Okay, so ways to keep our stomach acid or our stomach acidic is to make sure we are chewing our food. The easiest thing to say, the hardest thing to do, even for myself. I
Me
work,
too.
I'm running around.
I'm aware of it all the time.
Right, and in between patients, you're trying to gobble down your food.
All of us are doing that.
Right, and that is the number one thing.
Or you're on your device and
Yep.
you're not even paying attention to
You're
your
not
food.
relaxed.
You're not
You're
relaxed.
not smelling your food. You're not activating that brain. So I always tell my clients, hey, digestion starts in the brain. What you mean? So remember when grandma made that really nice pot of chili, and you're smelling it and you're salivating?
Yeah.
Exactly.
Now your
That's
body's
what you want.
priming you.
Exactly. That's what you want. Our saliva starts to break down our food. So we have got to stop. We've got to relax. We've got to enjoy our food. We've got
gotta
to have
breathe.
siesta again.
Yeah.
Yes, you've got to breathe. You've got to relax. You've got to chew. You've got to spend
Put
that
away your
time.
device. Turn off the TV.
Thank you.
Sit
Yes.
down.
Sit down.
Don't eat standing up.
Yes, sit down. Everyone tells me, oh yeah, I'm eating while I'm walking to the next class, or I'm eating while I'm walking to the next session, or whatever I need to do. So, and it's the same. I'm human.
We all do it.
Been there. I've done that.
And we know better.
Right, and we do, but the focus is making sure we keep our jobs. The focus is make sure we put
Pay
in
our bills.
Yes, so it is very difficult, but
But
once you
awareness is
start
the first step.
Right, and you start thinking about it, you'd stop.
Yeah.
You'd relax. You would chew.
And if you really knew how much it would help you,
yeah,
it would be a lot easier to do it.
Absolutely.
Yeah.
Absolutely.
So maybe I always explain to people that you need to be mindful
yeah.
in life and mindful when you eat. So like you said, sit down, first of all, put your device away, smell your food, like you said, chew your food.
Yeah.
So I personally try to chew my food 20 to 30 times. Some foods chew up a lot quicker just because they're not as strong. Some foods take 40 bites, like some meat, But what you'll notice is halfway through your meal, when you take your time, you begin to feel satiated.
Right.
And you don't need to eat as much. A lot of times we'll eat so fast and we won't chew our food, we'll overeat.
Right.
So then you get the benefit of also eating less calories. And if you're eating whole foods that are high in nutrients, then you're not going to have to eat as many calories.
Right.
Because the danger of processed foods, not only are they genetically modified, full of high fructose corn syrup, but they're also hyperpalpable. So what that means is people design these foods for you to eat more of them.
Right.
Like the chips, right? I bet you can't eat just one.
That's
true. Right, because it's designed in a lab for you to eat more. So I saw one of your posts the other day talking about the different food colorings and how they affect your body.
Yes.
So if you read the label and you see more than one ingredient, you can be pretty sure that it's processed in some form or fashion.
Right.
So some whole foods that people can eat, think about foods that have one ingredient. And when we say whole foods, we don't mean the grocery store. We mean food with one ingredient.
Right.
So broccoli is broccoli, beef is beef, chicken is chicken, fruit is fruit.
Right.
You want to make sure, and then the vegetables and the fruit that you're getting, you want to make sure it's organic.
Right.
Okay?
Absolutely.
Because on top of processed foods, you got foods with synthetic fertilizers, which have another set of issues that are created in your body. Not to mention how they get into our water, which runs into our oceans, which kills our fish. So I was talking to my daughter yesterday about, she's studying our environmental science, and she's talking about dead zones in the ocean. And I said, what can you do? And she's like, well, I can't do anything because the lawmakers are the ones in charge. And I said, actually, you could stop supporting people that conventionally farm with your dollars. So if we all were aware of who we're supporting and who we're giving our money to, we can make a difference.
And
so
our local farmers.
And when you eat beef, you want to eat grass-fed beef or grass-finished beef, because those animals are fed conventional corn, which also screws up their gut. And if their gut is screwed up, or they're injected with steroids and hormones, now your food is going to reflect that. So really, people need to become more educated about where their food comes from. First step. Second step, eating it the right way. And third step, understanding that they can make a difference in the world if they're aware and if they make a stand.
Exactly. And it's funny because I talk to my kids all the time about the same thing. I said, it does matter what you put into your body. I don't care the amounts, because I have friends that always says, no, I'm okay with my kids eating fast food once in a while. That once in a while could be once every month. Okay, so they're little, and as they grow, they're going to be eating that, and it's just going to be increased and increased and increased. Now, you've got your little kid.
Over time.
Exactly. And I always say your microbiome, starts from conception.
Even when you're in the womb.
Exactly. When you are birthed, it starts there too. Depends on how you were birthed. Okay, so everything that your mom ate and you ate from birth, it makes a difference until the day you die. So no matter what it is, and yes, changes can happen later on, it's fine. But if you are aware from the beginning, you need to continue from the beginning. And I always educate my kids on this. I said it matters. Source matters. So my daughter would say, if we go somewhere and something tastes bad and she's with a friend and she says, well, this tastes fake. And the friend looks at her and says, why would you say that? Right? Why would you say that? She says, well, I think this tastes like it has GMO. It was made of plastic or something. This is my 11-year-old, and I said, and I'm just smiling in the corner like, okay, I'm doing a good job.
And then she's affecting her friend.
Right.
who's also now got to think about it.
Exactly. So it's just those things. It does matter how much sugar you consume. I don't care. I always hear people say, but she's a kid. She can have whatever she wants. No, it is not. You are raising them, and whatever they start eating, it's what's gonna what they're gonna look at
is
later.
garbage out.
That's right.
Yeah,
You
their
know?
development is going to be affected by it. Their grades are going to be affected by it.
Absolutely.
Their performance on the field, is their
Absolutely.
self-confidence,
Yep.
their skin.
Yep.
If you really care about your kids, then you're not going to let them eat that stuff.
Absolutely.
I know it's
Yep.
easy. We've
Yep.
all been there, and I've done it with my kids too, but I didn't know any better.
Right.
Now I know better, and
Yep.
now it's my job to teach my kids
Right.
the importance of
Right.
these things.
Right.
One thing that I wanted to touch on too is the dangers of antibiotics, because I know plenty of people that will just say, "Oh, I'm sick, let me take this antibiotic."
Right. Yeah.
What does antibiotics do to our gut?
Oh my gosh. So any number of antibiotics you take, even if it's one dose, affects your gut negatively. Antibiotics kills good and bad bacteria. So it kind of kills everything. Has
Yeah,
no shame
it's
in the game.
nuclear.
It just kills everything.
Right.
It just kills everything. Now, if it's an emergency situation where it is needed right there and then, fine. But any amount of antibiotic really messes up your gut. And if you don't add a probiotic to repopulate your gut, then it's just going to be worse. Okay. So and as you said, anything people think of, oh, I'm sick, let me get an antibiotic. If you've got a virus, antibiotics are used. And we all know that antibiotics does not kill viruses. Okay.
Well, not everybody. I didn't know that.
Yeah, no. Antibiotics does not touch a virus.
Right.
It's only for bacteria.
It's
Just
funny you
bacteria,
say
so-
that, because I know people that will take somebody else's antibiotics if they're sick, because they automatically think,
Yeah.
oh, this is going to cure me.
Yeah.
So I
Yeah.
think people need to be aware, like we talked about earlier,
Yeah.
being responsible for your health, knowing what's going in your body.
Right.
Have you researched what is in that antibiotic and
Right.
what it does? Have you researched what's in those vaccines and what they do? Don't just take things blindly,
Right.
because they're not here for your best interest.
Right.
Those are businesses,
Right.
and businesses need to make money.
Right.
So they're going to do whatever propaganda they're going to put out. They're going to tell you whatever that they think you want to hear
Right.
in order to make money.
Right.
And
Yes.
when it comes back to probiotics, should people take them on a daily basis?
So it depends on you. Not all probiotics are created equal. Again, you mentioned money making. Probiotics, sometimes it's just made. We've got to know our source of probiotics. Now, yes, you can take a probiotic every day, but if you're not seeing any difference, and why are you taking the probiotic, first of all? Are you
Right.
taking it for overall health because someone tells you it's great for
Right.
you?
Is it like a
Or-
cautionary measure?
Right. Or are you taking it because you feel bloated and someone said a probiotic is good and you're just taking it?
Right.
So source is an important thing, and really looking into your gut and see what probiotic you need, because your bacteria will tell you what's there and what's not. And I may say, okay, according to your test, or, according to you, I really don't treat a test. I treat you. I treat the person. I don't treat a test.
Right.
My test is just guides, I would say, okay,
It's a map,
well,
right?
it sure is, but I'm still treating you,
Yeah.
I'm not going to go and kill the bad bacteria, but your mental health is not there. So I may focus on that first. Or I may say, okay, well, I see lots of things going on here, but your immune system's really low. We've got to focus on that first, But back to the probiotic, I may say, you know what, I want you to be on a bifidobacteria. I want that because you don't have enough going on. I need you to take one that has more of a lactobacillus in there. So I wouldn't say yes or no to take a probiotic every day. It's not a bad thing. But would
assess
say,
yourself first.
Right. Assess yourself first and know your source.
Yeah, don't just throw
Know your
darts
source.
at
Yeah.
it. So
Don't
what
go
are
to
some
Walgreens and pick up a probiotic.
Yeah, probably
You
not
know.
a good idea.
Yeah, no.
So what are some foods that promote good gut health?
So fermented foods. Again, I'm very wary when I say fermented foods, because I don't know if you've got an issue going on. You may take fermented foods and you may feel worse.
Okay.
But to promote good bacteria, fermented foods are great. Okay.
Like sauerkraut.
Kefir. Those things are really good to take, to eat on a daily basis, unless you've got an issue. If you got an issue, it may make it worse, because some bacteria may not like that. We got to get you back in order before I recommend foods. But I would, the main things I would really say is staying away from the sugar, the gluten, the dairy, the processed stuff that I know that's causing the issue in the first place, Right. But as far as fermented foods and all that thing, it's great to take. But if you're having an issue, you're constantly bloating, you've got diarrhea, you've got constipation, you've got all these different things going on, I wouldn't just blindly say, well, go do that. I would tell you to eliminate things rather than put in, because I don't know what you need.
Okay, so if somebody were to walk up to you and they would say, can you give me...
As they do.
Yeah. Can you give me some blanket statements that I can start to use today to improve my gut health and my overall health? What are some things that you would guide them to do?
Sleep.
Yeah.
Sleep is a big one.
Go to bed earlier.
Look at your mental health, right? So sleep overall is one of the biggest things. Chew your food is another one, okay? Stay away from foods that are causing these issues, okay?
Stay away from the sugars.
Stay away from the sugar. Stay away from the gluten.
What about natural sugars like fruit? Is that okay?
Yes, absolutely. You want those. Those are good. Remember, we still need our macros. Right?
And our micros.
We need it. We got to have that. We've got to have that. It's part of what our body needs. So the good sugars, you want it from your fruits, your berries. Berries are so important. I'm always pushing berries on everybody.
But
Get
organic.
your But organic, absolutely. Nothing that's made, you're still wasting your money there. And again, a lot of people tell me, well, it's expensive. I says, well, I know it's a couple dollars more, but think about what you're preventing later on. Do you want to spend the money on wellness, or do you want to spend on illness?
And you're not spending money, you're investing money.
Absolutely.
You're investing in your health,
in
your cognitive abilities, your longevity, your quality of life. And people are always thinking of the cost of things instead of the value of things.
Yes.
It happens in here all the time when people are like, oh, the gym is $150 a month. Oh my God, that's so expensive. And then I say, it's expensive if you think about the cost of it, but not the value of it. You're going to get in shape. You're going to feel better about yourself. You're going to meet new friends. You're going to relieve stress.
Positive mind,
those things are priceless. And those things are only going to cost you $5 a day.
Yeah.
How many times do we spend $5 a day on something that's going to harm us? On alcohol, on a cup of coffee after 12 o'clock, on food, eating out. Because when you eat out, guess what? Those restaurants are turning a profit. They're going to get the conventional vegetables, the conventional fruit. They're going to give you the cheapest stuff, and they're going to mark it up on you. So what you got to start realizing is change the way you think, and raise your awareness about what true health is. So why don't you tell us how people can get in touch with you and how they can get a test from you? Because I think I'm going to take a test now. I have my test.
I'm excited.
And then we're going to revisit it in a couple weeks, and you're going to help treat me. And we're going to go from there and see how we improve things.
Absolutely.
But I'm sure the listeners also want to get in contact with you because, like you said, this is the root of the problem.
Absolutely.
We want to address the root. So tell us a little bit about where we can contact you.
So you can contact me via Instagram, ANK Wellness, or my email, hello@ankwellness.com, which you'll probably provide.
Sure, yeah, I'll put
and my
it in
website's almost done. I'm very picky with the look of everything.
Good.
So I'm back and
You should
forth.
be.
Yes, I'm very picky. So it's been like a couple of months. So it's almost done. We're almost close. And I'll get that out to you guys as well. But right now, Instagram is great. My phone number, which you'll provide, is amazing. I'm pretty quick on responding.
Yes, you are.
And we'll go from there. I'm very excited to help as much as I can. I'm helping myself. I'm helping my children, my husband, everybody, my parents. Oh my God, I cannot believe that they actually agreed to do the test. Their own daughter. But again, it's the mindset. And you've known doctors all your life. I've known this doctor forever, but Dad, you're still sick forever. Dad, you're still overweight. Dad, you've got diabetes now. What is going on? So I've pretty much taken over my parents' care. They've done this test. I've pretty much seen everything that's causing everything. And I'm treating my parents. And I'm always on my dad. Hey, and he's sending me pictures of his shakes that he's making.
Nice.
And he's getting really excited about feeling better. My mom has dropped about 3 to 4 points every 2 weeks on her diabetes, her diabetic A1C,
Wow.
and she's excited. And I said, if you guys just listen to your little old daughter all these years. But it's okay, because you know what? You've got to be on that mindset. If you are not, I cannot get you there.
Yeah.
So, and it takes a lot. It takes a lot of time.
Well, we've been programmed.
There you go. So it's very hard to get you out of that program, but I will be on you like a hawk.
Yeah.
So you know how I am.
I
will be on you like a hawk, and I'm here to support you, and it's the most important thing. That's, and I'm there whenever you're ready, but you've got to be ready.
Yeah.
If you're not ready, then, come back when you are.
Well, I would say don't wait, because life is short, and you can improve your life with one decision.
Yeah.
And that decision will lead to many other improved decisions.
Yes,
and then you'll
agreed.
see a ripple effect across your life.
Yes.
And that's what I always preach to people. Put your health at the center of your life, and then you'll see a ripple effect from your relationships to your ability to perform in and out of the gym. And from that, you're going to improve your quality of life.
Yeah.
And when you are happy, then you can accomplish much more than when you're sad, depressed, and tired.
Absolutely.
So don't wait. Invest in yourself and contact Afreen.
Yes.
All right, guys. Thank you so much for listening.
Thank you, guys.
I'm going to leave all the relative links in the description, and I look forward to seeing you guys on the next podcast.
Thank you for having me.
Of course. Bam.